Okay, welcome back. Week 3 of the vlog here in Finland as a mental health nursing student. Three things I'm going to talk about today are nurse training, psychoeducation and ECT treatment. The nurse training here in Finland is very generic. It's very kind of spread across the board, certainly in terms of placements available to students in their training. They're able to go to pretty much everywhere in care, which I think actually has a really kind of powerful impact on people's knowledge and understanding, certainly around that kind of idea of holistic care. I think one thing in particular that stood out was kind of mental health nurses over here, their ability to really kind of understand and interpret results, such as like blood test results or like ECGs, and understanding that kind of having a direct impact on their ability to kind of understand physical healthcare needs as well as the mental health care needs. Obviously in England we specialise, so we have like mental health nurses, learning disability nurses, adult nurses and children nurses. But I know that that's obviously, kind of really crucial for our kind of learning, because, you get to learn the theories behind kind of illnesses and, kind of phenomenon. And, but over here they don't get that. They get a kind of fairly general brief on illnesses, diseases, and sort of, the kind of opinion that I've picked up on is the fact that, kind of it's stuff that if you're interested in it, you can kind of pick up on that, kind of do a bit of like home learning, home reading, which is great. That's self-research and that's, and that's really positive. But I just kind of like the fact that here in Finland, the fact that you can be trained generally gives you that kind of power over kind of physical health knowledge, and that understanding, and that being able to add to your kind of ability to care for somebody, holistically. I think sometimes in England we, there's an awful lot of research on some of the comparisons between people in mental health care and people in adult care, or across, across the population, life expectancy being kind of 20 years less in some cases. And, is that down to missed physical health care sometimes? Possibly. Maybe it's, I know I've worked with mental health nurses in England who haven't necessarily been too confident in physical health, like understanding physical health issues, which, we have specific training, and it's not always kind of the same for us as it is perhaps maybe for our adult nursing counterparts. But I just thought it'd be a really interesting thing to really focus on, especially given that I'm doing some research on that myself for my final research paper around mental health nurses and physical health issues, and our ability as mental health nurses in England to really work alongside physical health issues in the mental health care setting. I thought that was something of real interest. Secondly, then moving on to psychoeducation. I suppose this really is kind of being discussed because of like an experience I had working with some professionals on the ward here in Finland, and had a discussion around the importance of psychoeducation. And I know back home in England we have things like our 6 C's, and we have our kind of core values, and I don't know, I kind of just thought that the way that it was spoke about was almost like psychoeducation is almost a real priority of care. And I think that's just a really kind of important thing, probably because of the fact that it can impact on people's livelihoods and people's kind of future care or future lives, especially with regards to things like information around medication or information around like lifestyle choices, say for kind of like diabetes, things like that. But the professionals who I was kind of having conversations with were really, really enthusiastic around how important psychoeducation is. And I think it kind of touched a little bit on last week I was speaking about like legislation, and within the legislation it kind of really pushes that idea of like choice and and kind of autonomy. And I think that psychoeducation possibly kind of fits really quite well into that, in the fact that being able to kind of give people that information on whether it's medication that can improve perhaps people's medication concordance, or kind of if it's about somebody's illness and how to kind of best manage that. It's an opportunity for people to kind of own that really, and really kind of like take that care for themselves. And yeah, lastly, looking at ECT treatment, electroconvulsive therapy. I was kind of really lucky to be given the chance to see that twice, as it happens. Kind of pre-seeing the treatment, obviously done some reading on it, come across it kind of before in literature. I know that, kind of whether it's opinion or whether it's research, the jury's still out a little bit on just how effective it can be. For some people, it can be really effective. For some people, they have some really kind of negative side effects, and it can be really quite harrowing in terms of the the long-term effects of like memory loss and things. But the whole process as a whole was really kind of, obviously I think, on a personal level, it was really quite difficult to watch. It's something that, kind of, it is given in England. I think last year there was something like 1,300, 1,400, kind of treatments in England, but, kind of certainly rare amongst the people I've worked alongside. Maybe a couple of people know people who've had it, but I think probably just from my experience of what I saw, as a kind of treatment, kind of quite difficult watching that, thinking kind of about the kind of ethical side of what that treatment is and what it's about and what it's looking for, and and learning during the treatment. The doctor here was really quite was really quite nice. He was able to sort of talk me through kind of what they were looking for on the EEGs, kind of talking me through the whole process and trying to make sure that I understood kind of exactly what it was that was happening. Interestingly, there was a complication with one case, which meant they had to have kind of double anaesthetic, and the doctor was sort of talking about how that can kind of decrease I can't remember which, increase or decrease the seizure threshold, which meant they were able to kind of give the patient like a higher current or something, and that really kind of makes you think about what this treatment is and like how different it really is from certainly from like medication, certainly from from therapy. So it was really it was really interesting to watch, and really kind of makes you question what your own thoughts are on the treatment. I think prior to going in, I'd spoke to a couple of people here in the hospital about their treatment, and they were quite positive about it. They said they thought it helped them. Certainly with a patient who had like quite severe depression, said that it really helped. He had a couple of sort of treatment regimes, so I think he was on his second or third regime. But yeah, I think the other thing to bear in mind is the fact that there was a couple of side effects that were kind of, I mean, I don't know, watching two treatments and then knowing that there were one complication and severe side effects for another. It just makes you wonder sometimes about how effective that treatment is. Is it great for the long run but not so great for the short term, or kind of how that really impacts, certainly with like memory loss. That was one of the side effects for one of the patients. After they came round, weren't sure of what year it was, couldn't remember some really kind of key information about themselves, really distressing things, really really kind of difficult and quite nasty side effects, being honest. And for the other was prolonged seizures. Obviously, without probably reading up on that a little bit more, I wouldn't possibly be able to comment on exactly why that might have been. But it can, from what I read, it can be that ECT can kind of that can be a side effect of ECT with prolonged seizures. But that was really distressing for the patient, and thinking kind of, obviously I know when you have ECT, you don't generally sort of remember the treatment. It's not you kind of lose that like immediate short term memory, but then waking up and then actually having a seizure and kind of experiencing that seizure is something completely completely different. And I think kind of for me personally, just really got me thinking about the treatment as a whole, kind of where I stand on it, perhaps morally. Is it something that I'd maybe recommend to people if it was something that people were interested in, and that's a difficult question to probably answer. So yeah, some interesting things this week. I'm sure there's going to be plenty more plenty more interesting things that I'll see and come across. But thanks for watching, and see you next week. Goodbye.